right now to take you to the Minnesota Department of Health's COVID-19 update. They're expected to focus today's call on the first day of school. Let's go there now.
And thank you for joining us for the COVID-19 media call for September 8th. We'll start today's call with a situation report from MDH Infectious Disease Director Chris Ersman. Following Chris, we will hear from Minnesota Department of Education Commissioner Mary Catherine Ricker. After that, we'll open it up for questions from reporters on the line. I'll also mention that we have Minnesota Department of Education Deputy Commissioner Heather Mueller and Susan Clammer, the MDH Senior Epidemiologist, who's been working closely with MDE and other partners as we've gotten ready for the school year. With that, I'll now turn it over to Chris Ersman.
Thank you, Mike. For today, our global totals for COVID were above 27.3 million cases and 893,000 deaths. The United States was at 6.3 million cases and 189,000 deaths. In Minnesota, we added 387 cases yesterday for a new total of 81,608 cases. The median age of our cases is 35 years old. We added 2 deaths yesterday for a new total of 1,862 deaths in Minnesota. Neither of these deaths occurred in residents of long-term care facilities. One was in Hennepin County, one was in Ramsey County, and the total includes a person in their 70s and one in their 40s. There are 257 patients who are currently hospitalized, with 135 in intensive care. Just a quick update on Sturgis. We are now at 51 cases in Minnesotans who traveled to Sturgis last month. Sadly, this includes 3 hospitalizations and 1 death. Appropriate for the first day after Labor Day, today's call is focused on education issues, and we're happy to have Commissioner Ricker and Deputy Commissioner Mueller on the line with us today, as well as Susan Clammer. Before I turn it over to them for a brief update, I want to reiterate some of the key points we've been making as we've talked with school officials and families over the last few weeks. First, we want to thank MDE and school districts, teachers, and administrators from around the state for the incredible work they've done over the last few weeks to get us to this point. Every school and every community has its own unique set of challenges and considerations. And at MDH, we've worked with local officials to consult with them on how best to approach those challenges. We've been impressed with their dedication to safety and their focus on finding the right approach for their schools. With that groundwork in place, it's critically important that parents and families do their part to make these approaches as successful as possible. The role for parents and families includes limiting potential exposure to COVID-19 by social distancing, wearing masks, and avoiding crowds, watching for potential symptoms and staying home when sick, getting tested when appropriate, and staying home while awaiting test results. Parents can also help make the school year more successful by making sure their kids are up to date on their childhood immunizations and that they get their flu shots this fall. Boosting our health and protecting against all manner of illnesses is an important part of the process because it reduces the burden on our healthcare system and it reduces the number of families and students experiencing those symptoms that could be flu, COVID, or other illnesses. Flu shots are now available at various locations around the state, even including drive-up options. Of course, if you, your student, or anyone else in your household has potential COVID symptoms, that's not the time to get the flu shot. While we are all eager to return back to school and connect with others in our school community, it is also important for staff, students, and families to remember and follow guidance about when they should not be in school. If you are sick, stay home and consider being tested for COVID. Follow your school's policies about how long to stay home if you're sick. You may need to stay home even if you're feeling better. If you've had a close contact with a confirmed case of COVID in your home or in other activities, stay out of school for the full 14 days of quarantine. Remember, you can't test out of quarantine. By staying home when you're sick or have been exposed to a positive case, you're helping your community stay in school together. Now I'd like to turn it over to Commissioner Ricker.
Thank you so much, Chris. Hey, good afternoon, everyone. This is Mary Catherine Ricker, Commissioner of Education, and welcome to the beginning of the school year. Well, today is the traditional first day of school in Minnesota. We all know there is nothing traditional about the school year. What is typically a universal experience for students and families across our state has turned into a truly unique experience that looks different for every school district or charter school. Educators, administrators, paraprofessionals, school nurses, nutrition workers, bus drivers, custodians, and every adult who works in our school communities has worked incredibly hard this summer on their plans to keep students and school staff as safe as possible. And at the start of this unusual school year, we still have what it takes to keep our schools radically student-centered. The pandemic has forced us to change many aspects of our everyday life, but what this pandemic did not take away from us are our shared values about educating students, the values that put our students' health and well-being first. Today, schools across the state are putting their plans into motion and starting the school in one of three learning models: in-person learning, hybrid learning, and distance learning. And I believe they are all ready. Like we have emphasized many times this summer, making sure the needs of each and every student are being met this school year is going to take an all hands on deck approach. Everyone has a contribution to make as we launch this school year and continue to fight this pandemic. Educators, administrators, and school staff, you have gone above, beyond, and out of this world for our students this year. As you know, outside of the awesome impact that you have on our students during the school day, you are also leaders in our communities. So when you are not at school, please remember to also continue practicing social distancing. Don't gather in large groups, wear your mask, and wash your hands often to continue to protect yourself and your school community. Families, I know this pandemic has been hard on you, especially for our Black, Indigenous, and families of color. And I want you to know that your school communities are here to support you and your child, just like they are every school year. We do not expect you to be teachers or feel like you are solely in charge of your students' learning. We do need your partnership to help in fighting this virus, like continuing to be a role model for your child by wearing your mask whenever you are in public places, laying low and limiting the number of people your family is interacting with, even at a social distance. And please keep your child at home when they are sick. And I have a special note, both to educators and families, about being sick and having a sick child. I know what it's like to be a working parent and to be a teacher weighing whether to go through the work of writing subplans or just toughing it out if I'm sick. Both situations feel incredibly overwhelming. I have been that parent trying to decide whether my child is too sick to send to school so I can get to work. I have been that teacher worried about the burden on my colleagues if there isn't a substitute. I am urging you to please stay home when you are sick. Keep your child home when you are sick this year. Our school communities will be counting on all of us to put our health and the health of our school communities first, which means businesses, we're going to need your help too. So here's my message to our businesses in the community. Please be flexible and do whatever you can to support employees with school-age children as they will be navigating sometimes rapidly changing schedules this school year. Their need to stay home with a sick child will actually help keep our school communities healthier. So business owners and managers, your flexibility and helping employees will actually help strengthen our school's safe and healthy learning environment. You will be a key contribution to this school year. And Minnesotans, your contribution matters too. Please continue to do your part by wearing your mask, social distancing, and washing your hands. And also offer patience and understanding as school leaders and educators promote the urgency of equitably meeting the needs of students through the safest and healthiest teaching and learning conditions possible. This is going to be an unpredictable school year, and we are all dedicated to doing our best. If all Minnesotans work together and keep our decisions student-centered, I am confident that we will have a safe and successful school year. And with that, I'll turn it back over to Mike. Thank you.
Thank you, Commissioner Ricker. Operator, we are ready to take questions.
Thank you. As a reminder, to ask a question, you will need to press *1 on your telephone. To withdraw your question, press the pound or hash key. Please stand by while we compile the Q&A roster. Your first question comes from the line of Jeremy Olson. Your line is open.
Yeah, hi. I'd first like to ask a bit more about reporting of school outbreaks and or school, what learning models they're at. I'm told MDH and MDE are coordinating on a portal, but I don't think that portal's up yet. So if you could provide more information on what level of information, the detailed information we're providing it, when and where you'll be providing it, that would be helpful.
Thanks, Jeremy. This is Chris Ersman. Yes, we are working on finalizing the details, but we will be providing information at the level of the school. And the question is the frequency that we will be doing that, simply because of the workload it represents to compile these data every day. So the plan is that we will have data by school available to you.
Thank you.
Chris, this is Mary
Continue, please.
I can give, until that launches, we do have some preliminary numbers for you, because so this does not include all 576 school districts and charter schools in the state at this point. However, with 426 of those school districts and charter schools reporting, 267 of them are reporting some kind of hybrid model. That represents 63% of those reporting so far. 53 of them are reporting only distance learning, which represents about 12% of those reporting so far. And 106 are reporting only in-person learning, which represents about 25% of those reporting so far.
Jeremy, just let me clarify, that's all of the districts. That's not the ones that have outbreaks.
Yeah, this is representative of districts that have been that we've been able to populate so far. 426 school districts and charter schools reporting.
And this is Deputy Commissioner, and I think that, Jeremy, the question is really, you're getting two answers. One is asking about if there was an outbreak, how that's going to be reported, and that was what Chris was, Harrison was talking about, is how we were going to be able to report if there were outbreaks and what that was going to look like, and information will be forthcoming about that piece. And then what Commissioner Ricker was talking about is what the learning model portal is going to be able to give information about where each school district or charter school is at in their learning model and how that fluctuates. And so that learning portal portal will be up and running in the next couple of days, and that will be available on the MDE website, and will be open for anyone in the community and the state to be able to review. And so I think that there were two components to your question and two components to those answers.
Thanks, Heather, for clarifying that.
Permit a slightly unrelated follow-up question. Chris, I just wanted to ask about the numbers on the state dashboard, because one of the first times this summer we're seeing testing rate go down, but infection case rate going up. They've been in lockstep most of the summer, and now they're diverging. Is that a concern? What do you read into those numbers?
Well, certainly, we always say that, single days or, a couple of days don't make a trend. But I think that what we're seeing more and more community transmission, as we've been talking about for a number of weeks now. And with increasing community transmission, that means that the proportion of individuals who are likely to test positive has increased. And so even if we're not testing as many people, we're probably going to be more likely to find positives because of the amount of spread that's happening in the community. So that's concerning. Certainly, given the Labor Day holiday that just happened, we want to be cautious of how we're looking at the numbers for the last some days, simply because people obviously alter their plans because of that. But in general, we're seeing more community transmission, which means that the likelihood of finding positives when people are tested is increasing, and that is obviously concerning.
Thank you.
Your next question comes from Catherine Richards. Your line is open.
Hi, another question about schools here. Are you at all concerned about the number of students or staff who are showing up on the first day of school who don't even realize they have the virus, who might be asymptomatic or pre-symptomatic?
This is Chris. I'll start with that, and then I'll turn it over to Commissioner Ricker or Deputy Commissioner Mueller. Certainly, we recognize that asymptomatic transmission is something that we've had to deal with all along with COVID, and so that's definitely a concern. There's nothing other than being attentive if you know you've had an exposure and choosing activities that limit your exposure that anyone can do about asymptomatic transmission. I think what we are most concerned about is what we can control, and that is, as Commissioner Ricker said, if you're sick, if you have any symptoms, you need to stay home and get tested. So we acknowledge that asymptomatic transmission, is an issue with COVID, and it certainly has presented challenges with transmission. But you can't identify asymptomatic transmission unless you're testing everyone every day. But what you can do is you can make sure that if you have any symptoms that you're staying home, that you're getting tested. And I'll turn it over to Commissioner Rickers or Deputy Commissioner Mueller if they have additional comments.
Thanks, Chris. I will add something briefly, and then if Deputy Commissioner Mueller wants to add something, I welcome her to jump in as well. And first, to just reinforce your point of, of course, we're always concerned about asymptomatic transmission, and that is one of the reasons the Minnesota Department of Education and Health and our school communities, quite frankly, across Minnesota, have been taking these mitigation measures so seriously. And we've had school staff working all summer to prepare buildings for the physical distancing, for hygiene and hand washing stations. We've had principals in their buildings with tape measures. We've had custodians moving furniture, pulling it out. We've had school clerks setting up their offices to provide for safe and healthy interaction with school families. And in the state of Minnesota, it's one of the reasons we also prioritize purchasing masks and shields for school staff to be able to contribute to those mitigation measures, because wearing a mask, practicing physical distancing, washing your hands, we know those mitigation measures are effective, and we know that as school communities we've taken those very seriously, and that's one of the first things students and staff and families will see when they get a glimpse of our schools. Deputy Commissioner Mueller?
Thank you, Commissioner Ricker. I think the other piece that's important is the proactive approach to providing saliva tests to our school staff. And also, as Commissioner Ricker had mentioned, in addition to those saliva tests, is also thinking about the provision of face masks for our students as well. And so we recognize that that is a distinct possibility, and are thinking about all of the mitigating factors to be able to help to support the elimination of the transmission of COVID in schools.
And just a quick follow-up, this is for Commissioner Ricker. I guess I'm wondering, in a year like this one, how realistic is it to expect that students will meet the state learning standards?
I think our teachers are going to be teaching to Minnesota's academic standards every day. and they're going to be supported by paraprofessionals and by their school administrators and other school professionals. And that is what we're dedicated to as educators, teaching to those academic standards. And we're going to find a variety of ways to make sure we are offering high quality, timely feedback to students as well, so that students and families have really a meaningful idea of how they're doing in relation to those standards. Additionally, I would say that in addition to those academic standards, we know that social emotional learning is going to play an incredibly important role, as it always does every school year, but in an unusual school year, it's going to take a very, very advanced, prominent role in the work our school staff will be doing to meet the needs of students in any of those learning models. And so, again, recreating those strong teaching and learning conditions where you're meeting the academic and social emotional needs of students is a priority in any one of those learning models, in person, hybrid, or in a distance learning setting as well.
Okay, thank you.
Your next question comes from the line of Darren Svensson. Your line is open.
Thank you. This question primarily for Chris, and just with our news coverage schedule over the last couple of days, do you have any specific numbers regarding the free testing event that was held in Mankato last week? How many people took advantage of that?
Darren, I can give you some rough numbers. So I can tell you that we had over 1,800 individuals who sought testing. That at this point, I'm aware of 46 individuals who tested positive. And so the positivity rate was just over 2%. And I will work to get more exact numbers for you.
Thank you.
Our next question comes from Hugh Keefe. Your line is open.
Hi there, a couple of questions. Wondering, first of all, among the districts that went back earlier than today, if there has been any known outbreaks among any staff or students in those districts.
I'll start. This is Chris Harrisman. I'll start by saying that when we've looked at the data since August, so this is really looking, at the preparation time as well as some of the early cases. We have had 236 cases of COVID that have been associated with either staff or an attendee. 80% of those cases, 81% of those cases were in staff. And most of the situations in which we were seeing COVID had just a single individual, a single case in an individual. That was in 81% of the situation.
And those numbers go back to when? They're not all like in the past week, are they?
No, they're since August 1st.
Okay, so that includes some summer school then?
Yes, we were trying to focus on situations, and I'll ask Susan to speak up here, but we're focusing on the more recent situations. So in other words, the preparation for school starting and things. But Susan, do you want to comment?
No, I think you pretty well covered it, Chris. Yep. So that's looking at all of those cases. There were some summer school, but that was very much towards the tail end of summer school. So not a lot included there.
Okay. And then one question for Commissioner and Assistant Commissioner of Education. How many districts wanted to start in one learning model and the state advised them that they need to start in a different learning model? We heard from Republican lawmakers that they knew of one district in central Minnesota that was the only one they knew of. So hopefully you can shed some light on that.
Yeah, this is Mary Catherine. I appreciate that question. I don't have a number for you around would want it to start in one learning model, but then needed to start in another learning model because of their because of the county case data.
Did that answer your question?
Well, what I got from that was the commissioner is unsure. You don't know.
I guess I was trying to clarify. You were asking if so a school wanted to start in one model, but their county case data and their mitigation meant they needed to start in another learning model.
Exactly. The school wants to start in a looser model. The state says, no, you need to start in a more restrictive model.
We've had a number where, ideally, we would love to, have as many students in as possible, but we are using the county case data as well as the ability to use those mitigation measures to determine what the healthiest start is for all of our school districts and our charter schools.
And there have been a couple of situations in which, recent COVID activity has meant that a district has had to relook at their current model.
And that's what the consultation process is for, so we can walk through both the Department of Health and the Department of Education can walk through both that county case data as well as the mitigation measures.
Your next question comes from the line of Jeremy Olson. Your line is open.
Well, right as we're talking about schools and outbreaks, if we can flip Chris to college, Winona State just had to put in place a quarantine because they had a pretty big case outbreak and even some asymptomatic cases spreading there. I wondered if you could comment on that. And I mean, is that the inevitable tip of the spear for the rest of the schools, or is that something that's preventable elsewhere?
Well, we're certainly aware of a lot of activity that is centering around our colleges and universities. And so, yes, Winona had cases that were pushing over 200. And so they looked to a stay-at-home order for their campus. We also know that Concordia Moorhead and Minnesota State Moorhead collectively have a large number of cases. And Mankato has stabilized, but we'll see what comes after the holiday weekend. So we're definitely watching colleges and universities, and our higher education team is proactively reaching out if they are seeing, an increase in activity. I really think that it's a situation, however, where it's really going to be up to the students as to whether or not we're going to continue to see transmission. Because as we've mentioned on earlier calls, the transmission that we are seeing is really focused on social activities outside of the learning setting and not so much based on interactions on campus.
Thank you. And just another question. It sounds like Health Partners had such a response to the vaccine trial last week that at one point their website, the enrollment website, crashed. I don't know what that says, but it says something about a lot of interest in vaccine. I just wondered if you could comment on that.
Well, we've met with Health Partners and had conversations with them about the trials that they are participating in, and they really wanted to make sure that they had good participation. And so I'm delighted. Well, I'm not delighted that their website crashed, but I'm certainly delighted to hear of the great interest in vaccination. There's been a lot of conversations about vaccination, and as you know, the team here is working along with local public health and tribal partners to get plans in place. We know that when the vaccine is first available, it will be in limited supply, but we also know that as we move forward, it will be really important that we have a large proportion of our population who's vaccinated. So I'm really delighted to hear that there are a large number of people who are interested in that. And I just want to reiterate that from the perspective of the Department of Health, not only do we want to have an organized plan for providing vaccine from a logistical standpoint, but we have a commitment to making sure that the vaccine that's provided is safe. And so we'll be looking to our federal partners like the Advisory Committee on Immunization Practices when they give their recommendation that they feel that the data on the vaccines are sufficient to suggest that the safety criteria have been met, then we'll be very delighted to provide vaccine.
Thank you. Operator, we have time for one more question.
Your final question comes from the line of Catherine Richards. Your line is open.
Yeah, going back to elementary, middle, and high schools, I think there's still a bit of confusion as to what the threshold is for a school district to either, go from all in-person to hybrid or hybrid to distance. I think what we've been seeing is that if there's a case, even just a couple schools or sometimes districts are shutting down or going all to distance learning. In theory, I guess you shouldn't have to shut down an entire district if there's only one or two cases, but it appears that's been the approach so far. So can you just comment on at what point a district or school should decide to go to distance or quarantine?
This is Chris. I'll start and I'll ask Susan to add on here. I want to acknowledge that there are certain situations in which a case in an individual may be such that that individual plays a role in the running of a school such that continuing may not be possible. But the guidance that we've put together certainly looks at the broader perspective of, who's been exposed, what kind of transmission we're seeing in schools, so that a single case is not intended to mean that a school or a district has to move to a different learning model. But I'll ask Susan to expound on that because she knows it so well.
Thanks, Chris. Yeah, I would say that in general, it would not be our recommendation, just blanket statement that a center or a school rather that has only one case that was relatively limited in the amount of exposure shut down, and certainly not at the district level. What we have encouraged in our school reopening plan is that we really look on a school by school basis. It's highly possible that there could be a school, within the same district that's a couple miles away from another school that may have cases that needs to shift their learning model, and other schools that are nearby would not be impacted directly. So certainly there's some decision making there that needs to happen at the district level about what's actually feasible for them. But we have made it very clear, I think, in our recommendations in the Safe Learning Plan that this is really there's a breadth of considerations that we take into account. So in some of the cases that you're referencing where there maybe was one or two cases, it's likely that there was some other circumstance that contributed to those schools and districts needing to make a decision about closing or changing their learning model, not simply because there was one specific case.
Thanks, Susan. And before I turn it back to you, Mike, for Darren, I just wanted to let you know more specific numbers. In Mankato, there were 1,863 people tested, 46 positives for a positivity rate of 2.5%. And there was a high representation of college-age testees. So with that, I'll turn it back to Mike.
Thanks, Chris. That's all the time we have this afternoon. If you do have follow-up questions, please feel free to reach out to the MDH or MDE communications offices this afternoon. Have a good day, and we'll be back with you again tomorrow.
You were just watching state health officials give an update on COVID-19. We'll have much more on the first day of school coming up on our evening newscasts and on CBSN Minnesota.